Let me say right now, if one of your goals is to not have to wear glasses after cataract surgery, you need to make that abundantly clear to your surgeon. Every day, I get asked, will I still have to wear glasses after cataract surgery? For the medical community, for insurance companies, for Medicare, cataract surgery is about removing the cloudy lens that has developed, your natural lens that has gotten cloudy over time, and replacing it with a clear lens. The goal of cataract surgery for us in the medical community is to get you to see better. So, the goal of cataract surgery is to remove that opacity and get you seeing better with or without glasses. Now, as cataract surgery techniques have improved over the years, and the intraocular lenses have improved over the years, and the risk of complication has decreased, and the recovery time has gotten shorter and shorter from surgery, more people now view cataract surgery not only as a way to remove the cataract, but also to decrease their need for glasses. But for many of us in the medical community, that is really not the primary goal of cataract surgery. The primary goal is to get you seeing better, whether or not you wear glasses. If your goal is to see well without having to wear glasses, you need to make that clear to your doctor, to your surgeon, so that everyone's on the same page. Because the last thing you want and the last thing your surgeon wants is for you to end up with an outcome that you didn't expect. So, the medical part of cataract surgery is simply removing that cloudy lens, putting a clear lens in, we prescribe you glasses afterwards, and you see well with glasses. For us, that's goal accomplished. You've had a successful surgery, you see well with glasses on. The second component now to cataract surgery is what we call the refractive outcome. How well your eye focuses light when you're not wearing glasses. If that's important to you, then we need to talk about the different options for your lenses. We need to talk about whether you want a multifocal lens or a monofocal lens. We need to talk about correcting your astigmatism. We need to have a discussion about what you want as far as your refractive outcome. To the payers who pay for cataract surgery, they are going to pay for you to have a surgery because even with glasses and even with the best possible glasses, you don't see as well as you could. And so they are willing to pay for you to have that opacity, that issue, that medical problem that you have dealt with. Whether or not you wear glasses afterwards is really irrelevant to the insurance companies who are paying for your cataract surgery. That's not to say anything negative about them. They are paying for you to have cataract surgery. Whether or not you wear glasses afterwards, that's really a lifestyle choice. But that's exactly it. It is your choice. And for many people, it would be nice not to wear glasses. The point I'm trying to make is don't take it for granted that you will not have to wear glasses after cataract surgery. That's a very intentional process and a very intentional thought process and discussion to choose not only the type of lens that would give you the most independence from glasses, but also the power of that lens and to correct any astigmatism that you may have in your cornea, and to have a discussion about what issues may limit your vision after cataract surgery. To us as ophthalmologists, we are concerned with something called your best corrected visual acuity. That means how you see with the perfect pair of glasses for your eyes, your best corrected visual acuity. And if you do not see well with your best corrected vision, then that's when we start thinking about doing cataract surgery. For many patients, what they're concerned about is, yes, obviously everyone is concerned about their best corrected visual acuity, but for many people, they're concerned about their uncorrected visual acuity, how they see whenever they're not wearing glasses. And if it's important to you to have good uncorrected visual acuity to be able to see well without glasses, you need to make that clear to your surgeon. And so they can talk to you about whether or not you're a candidate for different lenses and whether or not that's a realistic expectation for you after surgery. I have other videos, and there are many other videos on YouTube and throughout the internet about the different types of lenses that are available. If you've not had cataract surgery yet, I encourage you to educate yourself about these different lens options, and of course, have a discussion with your surgeon before surgery about the different lens options and how your vision will be after cataract surgery. The goal of cataract surgery, of course, is to get you seeing better, but you want to make sure you and your doctor are on the same page about what exactly that means. I hope that what I'm saying spurs some thought and some research and some thinking about how you want your vision to be after cataract surgery. I love when a patient comes in for consultation and they're already educated about what the options are that are out there. And then we can have a discussion about what they're candidate for and what they want to have. Give this some consideration. I look forward to seeing you on the next video. Did I mention that I wrote a book about cataract surgery and what to expect before and after cataract surgery? You'll find it in the link below.